Thank you for this opportunity to present our work on acute stress screening in pediatric trauma patients. I have nothing to disclose. Existing data suggest a focus on early post-traumatic stress symptoms following injury may assist in identifying not only those children with severe early distress who need immediate intervention, but also those who would benefit from ongoing monitoring. Measuring the natural recovery that young populations undergo within the first weeks after a trauma can inform their clinical management team when to commence treatment. We developed a process at our Level 1 Pediatric Trauma Center to screen patients for acute stress symptoms at the time of their discharge. To screen patients, we use a validated short form of the tool, the Acute Stress Checklist for Children, called the Ask-6. This short form tool is validated for children ages 8 to 17. In partnership with a licensed social worker trained in trauma-focused cognitive behavioral therapy, we then developed a parent proxy screening tool mirroring the Ask-6 to screen children ages 2 to 7. A score of 6 or greater is considered positive for the validated Ask-6, so we also considered a score of 6 or greater positive for our parent proxy tool for the younger children. All patients, regardless of their score, received information about acute stress disorder on their discharge paperwork and were also provided with contact information for counseling services. All symptomatic patients with a score of 1 or greater were evaluated 1 month after discharge with a phone call from our trauma clinic nurse. Patients who were still symptomatic were referred for mental health services at that time. Of 344 admitted patients, 74% underwent screening, and the median age of those screened was 11 years. There were no other significant differences in demographic characteristics between patients with true positive scores of 6 or greater or those with scores 1 to 5. Female patients did have a higher percentage of acute stress symptoms with scores of 6 or greater, though this was not statistically significant and likely related to sample size. At discharge, 76% of patients endorsed 1 or more symptoms, and 19.6% had a true positive score of 6 or greater. At 1 month post-discharge, we were able to make contact with 75% of those patients screened at discharge. 40% of patients with a score of 6 or greater had persistent symptoms at 1 month. Of those, 56% accepted referrals for mental health services. In addition to the acute physical trauma at the time of injury, children who experience traumatic injuries may also have psychological effects that can be long-lasting. It is possible to screen patients for acute stress after injury, but for those that test positive, it is important to then pair it with an intervention. Further work is needed to understand patient-reported outcomes around stress, anxiety, and depression after injury in the pediatric population, as well as to develop mechanisms to ensure patients get the needed mental health follow-up. Thank you very much for this opportunity and for your time.